Dear Flux attendees or anyone watching this video, my name is Dr. Anthony Chifuni, visiting scholar at Stanford and psychiatrist at McGill. In this short video, I'll be presenting our poster, which features work accomplished in Ian Gottlieb's lab, co-authored with Lauren Borchers, Tiffany Ho, and Jackie Kirschenbaum. 2020 will be remembered as the year we faced the global threat of the COVID-19 pandemic. During this period, adolescents were a particularly vulnerable group for mainly two reasons. First, because they were directly impacted by lockdown measures, with school closure and important repercussions on their social support system. Second, this period of unprecedented stress is taking place against a backdrop of continued neurodevelopment, meaning increased sensitivity to changing social stimuli. A key brain circuit involved in several aspects of the stress response is the frontolimbic system. Indeed, functional connectivity of the ventral medial prefrontal cortex with subcortical structures such as the basolateral amygdala or the ventral striatum has been associated with adolescents' predisposition to psychiatric disorders. In this project, we set out to examine whether ventral striatum and the nucleus accumbens and ventral caudate and basolateral amygdala connectivity with the VMPFC assessed prior to the pandemic explains variation in adolescent psychological distress. We leveraged data from two study groups of adolescents for a total number of participants of over 300. Assessment of COVID-19 psychological outcomes were performed via an online survey sent out to all participants. 151 responded. We used the Coronavirus Health Impact Survey, the CRISIS, specifically designed to assess pandemic-related mental health outcomes in teenagers. Among responders, 99 subjects had a usable resting state fMRI scan collected on average 1 year before the pandemic. From these scans, we extracted frontolimbic functional connectivity measurements of interest, which are illustrated right here. In the next figure, we display scores on the crisis before and during the pandemic on each emotional item of this measurement. As you can see, each item, several items such as anhedonia and irritability show marked increase from before to during the pandemic. The crisis also provided items specifically assessing pandemic-related stress, such as the stress of social restrictions. In this table, all the items that we use are listed. Combining all those items, we ran an exploratory factor analysis. The most satisfactory solution of this factor analysis was a two-factor solution, with factor one being change in negative affect, and factor two, stress reactivity. In this graph, you'll be able to see how each item loaded on these two dimensions. Next, we examine the predictive value of frontolimbic connectivity with individual scores on these two factors with linear regressions. The complete results of these analyses can be found in this table here and are summarized in this figure here. As you can see, left VMPFC ventral caudate connectivity was significantly associated with change in negative affect, while right VMPFC, basolateral amygdala, and bilateral VMPFC nucleus accumbens connectivity were significantly related to stress reactivity. These models control for age, sex, interval between assessments, and baseline levels of depression. They also control for multiple comparisons with FDR. These findings were also robust to the effect of medication and study group. Overall, our results highlight variation in frontolimbic connectivity as a marker of adolescent susceptibility to external stressors and predict different dimensions of their psychological distress. These findings have potential application for the assessment of mental health care of adolescents affected by the pandemic. Continued investigation of psychological, social, and biological determinants of stress vulnerability could inform evidence-based intervention during or following the pandemic and orient future approaches that promote resilience in younger teenagers. Thank you for your attention. and I look forward to meeting you virtually during the conference. Thank you.